Hi everybody. It's been 13 days since I had my triple laminectomy L3, L4, L5 back surgery, and doing pretty good. I think I'm fine. Taking it pretty easy today because I'm just kind of sore, just achy, like my lower back's just muscles are just sore, and get my staples out on Thursday. Today's Tuesday, the 26th. Surgery was on the 13th of July. Some things I've experienced in the 2 weeks of surgery are the first couple of nights, they kept me in the hospital 3 days, 2 nights. That wasn't so bad. The bed was uncomfortable. You can't really move around if you get uncomfortable. You sort of get stuck in the sheets, and it's just, hospital beds suck. So once I got home, I was much more comfortable. I was able to sleep better. Had a couple of bouts of pretty severe sweating and like shivers, which for me, that just means pain. That was just pain. That's how I experienced pain. I never really had like bouts of, ow, that hurts. I had some achy, like, that's uncomfortable. But I get the shivers. Like if something hurts, I start to shake and sweat. That's how I do pain, I guess. I only took the oxycodone for, once I got home, I took it, got home on a Friday, the 15th. I took it up till like Sunday. I think Sunday at 6 o'clock was the last one I took. And then I just was feeling terrible. Because it wore off, like everything hurt. Like my hands would hurt, everything hurt. So I'm like, nah, this isn't right. So I just stopped taking it. I could have stopped sooner because once it was out of my system for 24 hours, Tylenol was fine. Worked great. So I can walk pretty well. I'm actually a little tired today and sore today from all of the walking and standing I did the past 2 or 3 days. Yesterday I did some food preparation, which I had to sit down in the kitchen and do it on a dining room chair in the kitchen and like work up on the counter trying to cut because I was just, my back was just exhausted and I wanted to finish what I was doing. So once I was done, I stretched out, and that usually helps. But otherwise, I feel pretty good. I'm just sore today. It's easy to overdo it with this kind of a surgery because there's a lot of muscle trauma, the way they have to cut your back open and spread the muscles apart, those muscles have to restitch. And for most people, that can take up to 2.5 months for those muscles to fully heal. When you kind of micro tear a healing muscle, it just burns. And I feel that all the time because I'm always moving and doing too much. It's just in my nature to do that. But I'm okay with it. It's not a bad thing. It just may take long to heal. The doctor thinks I should be healed in 6 to 8 weeks versus, the 2.5 to 3 months to 6 to 12 months that would take most people for this to heal. It's just, that's just my genetics, the way they work. I grow bone really fast too, so that's why I had such a hard time with all the issues with my spine. In 2003, when I broke my leg, they had to use a lot of hardware to put it back together. Titanium rod in my left tibia, which is your shin bone, and a bunch of screws to hold the rod in place. And then I had it removed 16 months later because I grew the bone back so fast. The screws backed out and the rod was pushing up out of my tibia and rubbing on my kneecap. So they just went in, they pulled everything out. That's good. Good and bad. It could be bad in a situation like with my spine. Otherwise, if you are considering having the surgery, take into account two things. I did not have any disc issues. My discs are good. They're healthy. They look great for my age, according to my doctor. And my spine is straight. There's no curvatures. All of the lumbar vertebrae are in the place they're supposed to be in. The vertebrae that he performed the laminectomy on were shattered in 2003, and I didn't know it. But when I had that surgery to put the titanium rod and screws in my leg, after the surgery, I couldn't lift my leg up off the floor. Like, I couldn't pick my foot up. You know, nothing against the doctors at all, but nobody thought to check my back. They just attributed that to the type of surgery and how badly my leg was broken. But, you know, 20 years later, we figured it out, so that's okay. I've been struggling with this for 20 years, so it's a long time. So if you are considering having the surgery, there's a few things I would recommend. I would recommend strength training before your surgery. As much upper body and leg strength training as you can handle. As much as you can do, because usually people that have this type of issue with their back, where I had nerves impinged and stuck, do what you can, you know. Sciatic nerve could be an issue with a lot of people. Bladder nerves, sometimes bowel nerves will be interfered with. You can have all kinds of problems. Get as fit as you can physically get, because once you have the surgery, you'll come out of it quickly. You won't be hurting for months and months and months or years. Some people, this is the least invasive of the surgeries, where you don't have a disc to snip out or trim off, and you don't need any metal rods or plates in your back or screws or any shit like that. If you're strong, your back muscles and your general fitness will be able to support the load on your spine. That's where I'm at. I mean, I have to lose like 20 pounds and I'll be right where the weight I want to be. But even at my height, I generally weigh right around 200 pounds. I always did. Even in my late 20s and early 30s, I was right around 200 pounds. When I was younger, yeah, I might have weighed like 185 pounds or 180 pounds, but I always weighed right around 200 pounds. I just had a discussion about this with a friend of mine, where he's like, no, you were skinny. I was never skinny. No, I always carried a little more muscle than a lot of people, a lot of my friends. So I could lose about 20 pounds and I would be perfectly fine. I would look normal like I always look, and have a little less load on my spine, which would make even this even a little better. But, you know, I was in as good a shape as I could be in before the surgery. So do everything that you can to get as fit as possible, and you'll feel a lot better after your surgery. This way you don't have any issues with a lack of strength or too much, I don't know what that's called, but like your back have some of the largest muscle groups in your body, your back and your legs. And when they cut into your back, the less fat you have on your back, the better of a chance you have of healing faster, with more strength at the end of the healing. You'll retain a lot of that strength. If you have a lot of fat on your back, you could have an issue with the fat sort of causing an issue with muscle healing, where the fat cells are damaged. You'll scar differently. The scar will feel different. Your sensory perception of the scar will be different. That'll affect how you feel. There could be more pain. So try to get as fit as possible. That really, really helps. Believe that I'm very fortunate that my surgery went well. I got a really good doctor, and he did a great job. I mean, all these doctors are good. There are no bad ones. But you're a component of the surgery. If you're not really in your best shape, you might have a problem with the surgery coming out of it. I got really lucky. I've been really lucky with all the surgeries I've had. So, I don't know how long that run's going to last, but we'll see. But try to be as fit as you can. This way you can get back to some normalcy. Sometimes after these types of surgeries, once they clean up all the bone that's impinging with nerves, you may get an issue with a nerve getting stuck somewhere else because there's a little more room and things are moving around better, and a muscle might get a hold of a nerve and grab a hold of it some way. That's okay. They can go in and clean that up really, really quickly if that's an issue. Usually there's no big issues. You might just have an issue like, oh, I got a little numb spot right at the top of my butt cheek. They know which nerve that is, and they go right in and make a little micro incision, and they just remove the little bit of muscle that's there. That's the way that nerve can move around. There's lots of ways to handle this. Having a good back and a healthy nervous system is crucial to vitality and living a pain-free life. So if this helps anybody, that's great. If this isn't helping, try to find answers, try to seek information. It's just my experience. Again, I find myself to be very fortunate and very lucky genetically, and with the luck of the draw for doctors and stuff. I've had a great care team, and my wife has taken a lot out of her life to help me the past couple of weeks, plus the past couple of decades. We're always making it work. So I think this is a really big addition to the improvement of the rest of my life, the quality of the rest of my life. I mean, there's things we want to do. I couldn't go walk around at Longwood Gardens without stopping at every goddamn bench I saw. I couldn't walk more than 100 yards without, completely almost begging to go get a wheelchair, take me back to the car. So those days are over. Little things like that are, things that I look forward to. So if you do too, I recommend getting the surgery. But be as fit as you can and have a good attitude about it. Relax, Try not to take the heavy painkillers. If you can avoid it, the first couple days you might need them, because that incision area is going to be pretty tender. But once that's over with, that's a lot of the pain that you are feeling is just, it's the drugs. It's when they wear off. Your brain can't compensate and handle the information coming in. So in order to shut you down to heal, everything's a pain signal. There are no pleasure signals when you're in pain. So that's why when you take the oxycodone, it floods your brain and, everything's great. It does the work for your brain. So over time, your brain stops producing all the appropriate chemicals, and you become addicted to opioids or painkillers, which I've never had any addiction issues. I don't believe it's in my nature to do that. It's just not something that I am interested in ever. I'll take a Tylenol for pain, but otherwise, no, I'm okay. I don't really need anything. So if you do have an issue with addiction stuff, like addiction issues, let your doctor know. And there's other ways to handle the pain. Because, once you're bitten and you have those issues, you will be bitten again. And you don't want that to become a component of your life when you've just had surgery and you're trying to improve your life. So if you're going to have the surgery, good luck. You do have a support group outside of your home and your friends. If anyone has any questions whatsoever, please ask. I will try to answer your questions as lucidly and coherently as possible. I'm not very good at explaining things, but if I can help, I'd be glad to help. Thank you.